a burning sensation, persistent itching, redness, and the uncomfortable feeling of having particles inside the eye. This is how Veronica, a London resident, described her discomfort when she was 43 years old. After an initial ophthalmological consultation, the symptoms were attributed to presbyopia, and corrective glasses were prescribed. However, the eye irritation persisted without relief. It was then that she first heard the name of a condition previously unknown to her: dry eye syndrome. According to the Tear Film and Ocular Surface Society, this disease significantly affects the quality of life of millions of people worldwide. The prevalence of dry eye disease study indicates that in Spain, approximately 1 in 5 ophthalmological consultations is related to this problem, although only around 33% of cases have a confirmed diagnosis. Overall, the estimated prevalence ranges from 5% to 50%. Dry eye is defined as a multifactorial alteration of the ocular surface, characterized by the loss of balance of the tear film. The variety of symptoms makes early detection difficult. However, it can seriously compromise visual function, daily well-being, and work performance. Although there is no definitive cure, there are multiple effective therapeutic strategies available. In Beatrice's case, the first approach included saline solution and eye drops with hyaluronic acid. I used them for several months, but the improvement was limited, she says. Now let's analyze the importance of tears. Tears play a fundamental role in eye health. They provide oxygen and nutrients, facilitate lubrication, and protect the surface of the eye. This thin aqueous layer acts as a true defensive barrier, since it contains lysozyme, an enzyme with bactericidal capacity, and antibodies that help neutralize pathogens. When tear production is insufficient or its composition is inadequate, what is clinically known as dry eye or keratoconjunctus sicca develops. This condition alters the tear film that covers the eye, causing dryness, irritation, and, in advanced cases, injuries to the cornea, the transparent structure that protects the iris and pupil, and to the membrane that lines the inside of the eyelids and the visible part of the eyeball. Among the most frequent factors are aging, hormonal variations, especially in women over 40, and certain environmental conditions such as wind, heat, dust, air conditioning, or tobacco smoke. The reduced blinking associated with prolonged screen use also contributes. Likewise, the use of contact lenses, laser refractive surgery, some drugs, and autoimmune diseases can influence its appearance. Eye drops, therapeutic serums, and artificial tears form the basis of treatment and represent the most commonly used option. In certain patients, and always under medical supervision, anti-inflammatory medications are added. In cases of severe dry eye, autologous serum may be indicated. Eye drops, made from the patient's own blood. Thanks to its high concentration of proteins and biological factors, it promotes the regeneration of the corneal surface and reduces eye inflammation. Beatrice was given individual doses for weekly use, which are kept frozen. They are thawed every week and applied between 3 and 5 times a day, he explains. She has been in treatment for 3 months, pending evaluation of her clinical progress. On the other hand, we have the influence of the environment on visual well-being. Environmental conditions such as wind, high temperatures, low humidity, altitude, or pollution directly affect eye health. Recent research has begun to examine interior spaces as possible modulators of this condition. A high concentration of polluting particles in the air has been found to be related to an increase in symptoms. While adequate humidity levels appear to have a protective effect, these findings suggest that improving the indoor environment through humidity control and pollutant reduction could be a valuable complementary therapeutic tool. And finally, we have the advances in research. In recent years, clinical trials have been promoted with innovative therapies targeting the various mechanisms involved in dry eye. An eye drop based on RNA interference RNA technology, designed to block the TRPV1 receptor, which is related to eye pain and inflammation. It is currently in phase 3 in more than 30 European hospitals, including several centers in Spain. If it proves effective, it would be the first of its kind worldwide. Eye drops with immunoglobulins, authorized by the United States Food and Drug Administration (FDA) as an treatment to modulate inflammation of the ocular surface. Although they do not yet have the approval of the European Medicines Agency (EMA), ocular nanotechnology applications. Researchers at the Complutense University of Madrid have developed eye drops with liposomes and hyaluronic acid intended to simultaneously treat dry eye and glaucoma, with encouraging preliminary results. The current trend points towards increasingly personalized therapies, where an accurate diagnosis is key to adjusting the treatment and preventing long-term complications. Remember that with every small step you take today, you build a stronger version of yourself tomorrow. If this video is helpful to you, please give it a like, subscribe to EquixLife and turn on notifications so we can keep growing together. See you in the next video.